Hey guys, we are going to go live with Dr. Cutris or Tanaya, who is our fun millennial doctor, and we're going to be talking about all things related to sex and PCOS and how the two work together. So I'm going to add Dr. Tanaya. Give me a few seconds. How do I? Okay, so she should be joining in a bit. Please get your questions ready for Dr. Tanaya. Hey,
Hello, hello.
hi Tanaya, how are you?
I'm very well. How are you doing?
You look very fresh and bright in the, what time is it in Austin?
It is 10:30. That is the only reason why I'm looking fresh.
Yeah, you look like what I would like to look like every morning, but I don't look this
You look lovely.
But welcome, Dr. Tanaya. So excited to have you. So for everybody else joining, guys, hi, I'm Shashwata. I'm the co-founder of Veera Health. For those of you who don't know Veera Health, my sister and I started Veera Health after she suffered for years and years with PCOS. For those of you who have PCOS, it's a very long, annoying journey of trying to get diagnosed and then trying to get the right advice. My sister was told all kinds of things around you have to lose weight or you will get infertile and all of those kinds of things. So we started Veera Health last year, and so far we've treated tens of thousands of women with amazing results. We basically combine all of the lifestyle coaching. So we tell you how to eat, how to exercise, work out, along with medical guidance from gynecologists and other doctors who tell you how to reverse PCOS. So it's been a fun journey, and I'm super excited to introduce and add Dr. Tanaya. I don't think she needs any introduction. Dr. Tanaya, aka Dr. Cutris on social media, is the first lady of all things reproductive and sexual health. She's also an award-winning trained medical doctor. She studied at Oxford. She's practiced in India, in England, and I think she's writing a book now. That's awesome. And I think the most exciting piece of this, Dr. Tanaya, is that you are now on the board of advisors at Veera Health, which is awesome. So excited to have you. And we're working together to spread more awareness about PCOS and make treatment for PCOS better and better. So, a few words from you, Dr. Tanay, before we kick it off.
Fantastic. Thank you so much for that extremely kind introduction. Yeah, so my name is Tanaya. I do sexual and reproductive health education on Instagram, and today we're partnering up with Veera, who, like you mentioned, I work with, and sort of debunk a little bit a lot of the queries that exist around PCOS and having sex, because people who are sexually active and who have PCOS have a lot of concerning questions that sometimes they're unable to ask their doctors in that space, especially if they're going in with their parents and things of that sort. So, yeah, I feel like there's a lot of questions we can discuss, and Veera is doing some fantastic work in helping patients with PCOS. So, let's help some more people today.
Awesome. Yay. Super excited about this. So, I think before we get into the fun stuff, which is, sex, maybe before that, let's even just talk about what is PCOS, right? Because I think a lot of people don't even know what that involves. Why is it such a big deal? Why are we talking about PCOS so much? Do you want to maybe take like a minute and talk about what PCOS is and why it's so common?
So, I think the first thing I do want to address is that people have this idea now that PCOS is a new thing that's recently become very common, but I don't think that's the case. PCOS has always been there. It's always been a condition that a lot of people have suffered with. Earlier, we didn't have all of these advanced technologies to detect hormones at such tiny levels. So, A, our detection capabilities have gone up, and B, now more and more people can go to the doctor. Before this, we just decide, oh yeah, she has maybe issues with conceiving, because a lot of people get diagnosed with PCOS when they try to have a baby and they have trouble with it. So PCOS is not something that has suddenly grown these days. It's always been there. We just are able to diagnose it and treat it better now. What is PCOS though? So normally we make a certain level of hormones in our body. They work in the background. They essentially run everything in our body. But what happens in PCOS is some of these hormones get thrown out of whack. And that can lead to a lot of symptoms. Most commonly, the symptoms people experience would be things like irregular periods, excessive facial hair, hair loss on the top of the head, acne, difficulty in losing weight, difficulty in getting pregnant. So these are some of the most common symptoms that one might experience with PCOS. And we have a lot of ways in which we can help tackle them.
Yeah, no, awesome explanation, Dr. Tanaya. And I think, we hear so many people say कि oh, हमारे ज़माने में PCOS हुआ नहीं करता था. But the thing is that now we're able to diagnose it. We know what's going on with your body, and there's ways to treat it and reverse it. You don't have to live with these symptoms for the rest of your life. You can actually manage them. Cool. So let's dive into the first question that we get a lot all the time, and that is, does having PCOS actually impact, anything around having sex, your, general sexual life? Like, what have you seen in that?
So not just what I've seen, but also we have a great deal of scientific evidence to back up this. PCOS, unfortunately, can also make sex difficult. So a lot of people who do have PCOS have issues with having a lower libido, which means their desire to have sex goes down. And as Shireen_Azim is mentioning in the comments, body image issues also crop up a lot for people who are trying to be sexually active when having PCOS. And, it's not just a hormonal thing, but it's also a mindset thing that can get impacted. So yes, your sex life can become more difficult if you are trying to have sex as a person with PCOS.
Yeah. Especially, I guess, with people who have weight gain along with PCOS or hirsutism with PCOS, the body image piece of it can be a big factor in sex drive, right? And have you, another question that we actually get a lot is, does PCOS make sex painful? Say you're having it for the first time, or if you've had, if you're not even just like a first time, if it's not the first time you're having sexual activity, can PCOS make it painful for you?
PCOS by itself technically shouldn't make sex more painful. The first time having sex can be a painful experience if you're not sexually aroused properly or if you're not lubricated properly. Some people may experience that because of the hormonal imbalance in their body, their vagina is not as moist. So if the lack of moisture is there, essentially just think about this, if it's really cold and your skin is breaking in the cold and you've not moisturized it, and then you go out in the windy weather, it just tears further and it really hurts. So that's why moisture is so important vaginally as well. So adding lubricant can help. And this would be the general advice for everybody who's having sex for the first time, because with PCOS, there is a theoretically, there is an increased chance of having pain, but we don't have any data to back this up. Okay, my comments are stuck for some reason. Oops. Okay.
I'm seeing a lot of questions. Maybe, and guys, please keep adding your questions. We'll take a bunch of questions towards the end. And I think tied to this, Dr. Tanaya, like, this is maybe a little less about PCOS and sex, but also just, how do women who are having painful sexual activity, or, how do women who are having, like issues around dryness when they're having sexual activity for the first time, like how should they go about communicating this? Because I think that's what a lot of women struggle with, right? Like you grew up kind of having a certain idea of what sex should look like. You see it portrayed a certain way in media. So do you have any tips around how women with PCOS, or in general women who are having painful sexual activity or other issues, how do they communicate that with their partner? How do they feel open? How do they open up about it?
One thing that, obviously the first is obviously sitting down and having a talk, but I understand that can become very difficult and awkward. So some people have found this technique very useful, where you literally just sit down with your partner and make a game out of it. You write down what you want to communicate to them on a piece of paper and then hand it to them, and they give you some feedback in return, and then you keep exchanging feedback, and every piece of feedback you exchange, you try it. So it's like exciting, it can be fun, it's sexy, it can be like foreplay, and it can also just be a date night activity. I don't know. I have
Yeah.
had I've had patients who have done this with a bottle of wine, sit down and just, let's clear the air essentially on this. And it can be quite fun and a bonding experience.
Yeah, that actually sounds like a really fun activity because, it's, having sex and sexual activity is just another part of your life. So, why should that be so hidden away? Like everybody at some point is going to do it. So, might as well have a conversation and feel comfortable about it. Okay, cool. Switching over into another question, especially around PCOS, right? Like around conceiving and fertility. Women with PCOS often have irregular periods, right? And so when they're trying to conceive or when they're thinking about, planning a pregnancy, do you have any advice on how they can keep a track of their ovulation date and, plan their sexual activity around that?
So unless you're extremely diligent with your natural tracking can be a more complicated way of predicting your fertility. It's
Right.
not as reliable unless you're being very, very particular. So, for example, some people who use thermometers to track their temperature, you
Mhm.
have to measure your temperature at the same time every single day. You can never be hungover or too drunk or too sleepy or too sick to get up and measure it, because then that throws your calculation out of whack. So, a really simple way is tracking in a calendar regularly and just estimating that, okay, this is a more fertile time or this is a less fertile time, as opposed to completely relying on it. What can help a lot of times is speaking to a doctor. If you have, I mean, the general guideline we follow is that if you're under the age of 35 and you've been trying for a year and you're unable to get pregnant, go to a doctor. And if you're over the age of 35, you go to a doctor in 6 months. And they can run some more advanced blood tests to see if you're ovulating, how you're ovulating, if you're ovulating properly, what is the reserve amount of eggs you have. So, like how much money you have in the bank, essentially. And these things can help in predicting your ovulation. With all of that said, I think it's very important to remember that PCOS का मतलब ये नहीं है कि infertility होगी. Some people have trouble, some people don't. It's fine. It's not a big deal.
Yeah, yeah. And there's so many women who actually do conceive with PCOS. It's totally possible. I think बहुत सारे लोगों को, they have this misconception that, if you have PCOS, that's it. That's the end of, any chances of you conceiving. But that's absolutely not the case. I mean, even at Veera, we see women who've struggled with conceiving for years and years conceive for the first time because they're managing PCOS. So definitely, guys, like see a doctor, like don't feel like you need to, suffer in silence about that.
Okay, I'm just going to quickly mute myself for 1 second because I really enjoy seeing the comments that come in, and I'm going to open this live on my iPad and see if I can see them comments, because sometimes they can also add to some of the stuff we're talking about. It can be really useful. But how do I make sure we don't hear ourselves? Oh,
So you can't see the comments right now at all.
I can't. The videos
Ah,
are stuck. Okay, now I can see it.
you
Now
can
it's
see
live
it?
on my iPad.
Awesome.
Okay.
We did get a bunch of questions, by the way, around whether PCOS can cause vaginismus or, how the two are related.
That's an interesting
I'm
area.
seeing that a lot. But how do you want to do it? I have a few misconceptions about PCOS and we can take questions after that, or we can keep taking
Yeah,
questions right
sounds
now.
good. No, just the inputs that come in. For example, somebody did mention body dysmorphia with PCOS. All of that can just add to some of the points that I think of. So I like that.
Yeah, totally. Okay, guys, keep sending your comments in. Obviously, Dr. Tanaya is very excited to read them, and we're excited to answer your questions there. So, a few common misconceptions about having sex if you have PCOS, and would love it if you can clear those up. One is that if I'm not getting my periods, and often in PCOS, women may not get their periods for more than the usual that 24 to 35 days stipulated time. So if they're not getting their periods, they don't need to use any form of contraception while having sex. What do you have to say to that?
So I did a post on this one time, and the analogy I used, I really enjoyed it myself. So I'm going to use the very same analogy once again.
Okay.
So all of us have this one friend who always says they're not going to come to a party and then they come. everybody has that one friend. When you throw a party, you'll be like, yeah, they will turn you down, and then suddenly, when the party is at full swing, when you run out of food and alcohol, this person will turn up and be like, hey, where's the food? Where's the alcohol?
Yeah.
Your ovulation is like that in PCOS. You're never expecting it, and then suddenly one day it will happen when you're least prepared. And that's why you should always be using contraception. That's why you should always have extra beer and extra food in the fridge for this one friend that says they won't turn up and then they turn up. So as long as you use regular contraceptive methods. Now, fortunately, a lot of people who are struggling with PCOS are already on the birth control pill for the hormonal effects, and this can have the side effect of being able to prevent a pregnancy. But if you're not on the pill and you prefer using an alternative method, please make sure you use it all the time, because you can very much get pregnant with PCOS. A lot of my patients who come to the hospital as pregnant, like as for getting treatment for their pregnancy, we just find out incidentally they have PCOS. So
That's a very interesting insight. And actually, this speaking of this trend that shows up at any given point in time, and you mentioned that a lot of people with PCOS are on birth control. How does it work if somebody is trying to treat PCOS and they're on birth control because that does help regulate periods, but then they're also trying to get pregnant or conceive? Like usually, are they told to stop that course, and how does that work? Beyond I don't know, when you're trying to conceive, especially.
this is a little bit more focused on personal profile of the patient, depending on what kind of symptoms they have, what are their hormone levels, because there are lots of different interventions we can have for somebody who's trying to get pregnant. For example, one of the more frustrating things about PCOS management is trying to lose weight. Most people find it extremely annoying, and it can be extremely tiring the way the weight loss process for PCOS works, because it's naturally harder for you to lose weight. But if somebody is trying to get pregnant, losing weight can help. So if you do reduce the amount of fat you carry, you can not just help your PCOS, but you can also help your ability to get pregnant. So one of the ways is obviously fat loss and weight loss and lifestyle interventions. Another way that we have seen that we have used quite often is something called ovarian drilling, where you take a drill machine and you drill their ovaries.
Not
No,
sound
it's
fun.
not like that.
Okay.
It's not like that. You we go through a procedure where we encourage the ovaries to release the eggs. Then, of course, there's fertility treatment. There is more medications. You can be given medications to encourage your eggs or encourage your ovaries to produce better quality and higher number of eggs. So there are lots of interventions we can use, and this is more patient specific depending on what are the symptoms they have.
Yeah. No, makes a lot of sense. Makes sense. I think it's like a confusing thing for a lot of patients because, they go to the doctor trying to treat PCOS, but then they put on birth control, but then they're like, no, but I'm actually also trying to get pregnant. So I think for everybody wondering about that, guys, you have to have a gynecologist or a doctor that you're talking to because it's really, really personal, as Dr. Tanaya is saying. Cool. One final misconception, and then let's move on to all of the questions that we're getting in the comments. So we also hear this a lot that if I have sex, that will help regulate my periods. That will make my periods go back to their regular, non-PCOS self. What do you have to say to that?
Short answer, bullshit. Long answer. Long answer, orgasms can help you bring on a delayed period. Orgasms are generally wonderful for your health. So it's like having ice cream. You can enjoy it, but don't expect to gain calcium, your daily requirement of calcium from eating ice cream. It's basically that. It can be helpful, but sex is not the answer to getting your periods all the time.
Yeah. Yeah, and this goes back to, I think a lot of women also hear ki, just wait until you have your first kid or you get married, फिर आपका PCOS एकदम cure हो जाएगा. I mean, even that, like, would you say bullshit to that?
Yeah.
Yeah. Yeah, guys, I mean, PCOS is a lifelong condition, right? Like, if you think of any other issue like diabetes or hypertension, I mean, it requires a way to manage it. You can't just kind of, Hail Mary, leave it up to God, and random events will, take care of PCOS for you. That's not going to happen. Okay, cool. So
Absolutely.
now let's get to the fun part that Dr. Tanya has been also waiting for. Should we go through the comments? Is there one that you saw already, like a question that you want to address? Because I actually spotted a few really good ones.
They're kind of flying past, so I'm not able to monitor them. And I feel like this is counterintuitive trying to run the iPad and this at the same time.
Yeah. So, okay, maybe let me kick one off.
Yeah.
I think Soumya Day is asking, is low libido due to PCOS or due to the contraceptives that are prescribed for PCOS?
That's a really interesting question. So, one of the main things that influences our libido is the amount of testosterone we have. So, low testosterone can cause low libido. The problem with PCOS is that you don't have low testosterone, you have high testosterone, and still people struggle with libido problems. So, this is maybe a chicken and egg question. A lot of people also find that going on the contraceptive pill, because it helps lower your excessive testosterone, it can help in restoring your libido. But for some people, it does the absolute opposite thing, who have had a healthy sex life and suddenly it just disappears. So, the frustrating part of this that science probably doesn't really have the answer to this question. But if you are struggling with a change in your sex drive after being on a certain medication, be it birth control, be it I don't know, an IUD, whatever you're using for contraception, you should speak to your doctor, because then they can suggest an alternative for you that can work better instead of sticking around with something that's clearly not doing its job.
Yeah. No, that makes a lot of sense. And, guys, like, I think everybody has a very different reaction to oral contraceptive pills, right? Like, sometimes it's a matter of just looking at different brands and trying a few different ones and seeing if, that's working for you better than another. So definitely, talk to your gynac about that, as Dr. Tanaya is also saying. So we're getting a few questions generally about PCOS as well. So I'll sprinkle those in along with the sex related ones. And guys, please put in your questions. We'll answer them. No judgment here at all. So just feel free.
Zero judgment space.
Yeah, exactly. So Harshita Verma is asking, what about irritation and depression due to PCOS?
So this is a very, very important thing that I personally didn't even know about until a patient asked me this. And then I went and looked it up, and I found that the rates for people suffering from anxiety and depression are higher in people suffering from PCOS. There's also a link with OCD. So if you have PCOS, you have a higher likelihood of suffering from anxiety slash depression slash obsessive compulsive disorder. So very huge integration of your mental health, which is why this is the thing I love about Veera, that you get a gynecologist, a doctor, a physical therapist, a nutritionist, and then mental health support, because this is something we miss so often about PCOS treatment. We just like, हाँ gynecologist के पास चले जाएंगे सब ठीक हो जाएगा, but gynecologist mental health के बारे में थोड़ी बता पाएगा ना. So definitely an increased risk. So if you are having any mood issues, or if you are struggling with your mental health, please speak to a specialist who can help you. Your risk of suffering from conditions is higher compared to the general population.
Yeah, exactly. And I think there was a study that I was reading where it said that women with PCOS are 4 to 8 times more likely to have anxiety, depression. So often it could be a result of your PCOS. So nothing to, feel like you need to blame yourself about. Like, it is something that you have to treat separately as well. Okay, cool.
Absolutely.
Another question, and I think this is much more related to the body image part of it that you were talking about, Dr. Tanya, right? So Nanta is asking, is it okay to have male pattern hair growth on the breasts, as I'm also suffering from PCOD? And I think more broadly, like, how should one think about this as it relates to, feeling positive about your body while having sex?
So this is actually something we did a reel together on Shashwata, remember?
Yeah.
So hirsutism is something which is excessive body hair, particularly in the male style. For a lot of people who have PCOS, and by male style we mean that there is more hair that kind of starts around your abdomen and then goes down, becomes bushier and bushier as between that patch between the abdomen and the pubic area. So it's like almost a line, and thicker hair generally across the body. So if you are struggling with hirsutism, this usually is a result of the excessive androgen or the excessive testosterone in our body. Again, to your doctor, like I keep saying all the time, is the best option, and then they can suggest treatment. So one of the best things that does work for lowering your androgen levels is, frustratingly, once again, lifestyle interventions. Quitting smoking, getting more exercise, eating a bit healthier. Now, screw weight loss. You know, I feel like we get so caught up in this idea that a lot of people start doing these unhealthy diets, these crash diets, and all of those things. So leave all of that to the side. Eat nutritious whole grains, eat more, good fats, eat all of that. Just improve the quality of your diet. And also, one of the things we've seen is spearmint tea can be helpful. We don't have a lot of evidence to back this up, but spearmint tea पीने में कोई नुकसान नहीं है, तो पी लो. And of course, medication. And the thing to remember with all of this is it takes a while. So if you're having excessive hair growth on the area of your breasts, you can use depilation, you can use, I don't know, waxing, shaving, threading, whatever you want to use. But for an actual change in the growth, it will take some time, at least a year.
Yeah. Yeah. And I think that's the point that probably a lot of people are not, that's the education that a lot of people don't have, right? Like, I think a lot of people try to start some treatment for PCOS, they wait for 1 month, 1 महीने के लिए 2 महीने के लिए try कर लिया, लेकिन कुछ हो नहीं रहा है. लेकिन these things, they take a year, they take a year and a half. Diabetes 1 महीने में क्यों, like, reverse नहीं हो सकता. Similarly, PCOS, it's a lifelong condition, so you have to give whatever treatment that you're taking at least 8 12 longer than 8 12 months, if not longer than that, right, to really have an effect. I think one more thing that you mentioned, Dr. Tanay, which was so interesting, is that with the diet aspect of it, right, like the lifestyle piece, which is what should you eat, how to exercise, how to manage your stress level, that is so critical in PCOS because it's such a big trigger. I mean, we've seen even with my sister, right, like the times that she's more stressed out, the symptoms just immediately flare up. So you need to have somebody who's working with you throughout, like on that journey, and giving you advice that you can action for yourself. क्योंकि वैसे तो हम सब जानते हैं कि healthy खाना है, junk food मत खाओ, oily food मत खाओ, like ये सब हम लोग सब
सुट्टा
जानते
मत मारो.
हैं. Yeah, like 8 घंटे सो, like stress मत लो, that everybody knows that. But you actually need like an expert team जो आपको remind करते रहे, like who keeps motivating you to do this regularly. So another really good question, which is also like interesting, and I don't know how many people have thought about this. Can taking too much of emergency contraception worsen your PCOS?
It's more difficult than a straight yes or no answer. The first thing to understand here is that yes, emergency pills give you a very heavy dose of hormones, and immediately they can cause side effects, like they can make you feel ill, breast tenderness, nausea. Some people find their, the period cycles date changes, they can get it immediately. Some people find that their period just goes missing for a bit. So immediately, yes, there are effects, but so far we don't have any long-term effects of taking emergency contraception pills. It's a general myth that I also don't want to call it a myth because you don't want to give yourself super doses of hormones, but ऐसा नहीं है कि emergency contraceptive खाने से PCOS हो जाएगा या infertility हो जाएगी. With all of that said, in PCOS your hormones are already kind of out of whack, and then in that disturbed situation you're throwing in more. So imagine there is, I don't know what's a good explanation for this. Imagine you're making yeah, you're trying to make atta for your rotis, and you add too much atta, you don't have enough water, and in order to not compensate for it, but just as a separate thing, you're like, hey, maybe I'll throw in some oil here. And then instead of throwing in a regular dose of oil to manage that atta, you throw in like half a quart of oil, which is going to make your atta worse. So it it's not that your rotis will not be good ever. You can, add different things and make better rotis, but why do you want to give it a super dose, which is a very convoluted way of explaining this.
No,
um,
it's really helpful actually. Go on.
um, we don't have any data to say that having emergency contraceptive pills makes your PCOS worse, but as a general guideline, don't have too many hormones. Use it in an emergency because it's an emergency contraceptive pill.
Yeah, yeah. It does wreak havoc on your body. And, like if you're having regular sexual intercourse, like consider getting oral contraceptives, consider using condoms, talk to your gynac, talk to your doctor about what is going to be good for your lifestyle. So yeah, that's super helpful, Dr. Tanaya. Um, this is also another interesting question. So, I mean, again, not related to sex specifically, but um, don't lose your soul is asking, which is a good piece of advice, I guess. Does PCOS increase chances of getting certain cancers?
Yes. Having PCOS does up your risk of not just certain cancers, but also getting diabetes and metabolic syndrome. So, diabetes, we all know, metabolic syndrome is when diabetes is coupled with hypertension and also obesity that is central, which means it is the excessive fat loss in your body is stored particularly around the area of your tummy, around your chest. So, this kind of fat is more harmful to your internal organs. So metabolic syndrome, diabetes, and then endometrial cancer. Um, we have the way our body regularly ovulates, so which is the way our body regularly releases an egg, is hampered with PCOS, as we all know, and this can increase your chances of getting endometrial cancer. So I know PCOS treatment can be frustrating because it's a long-term treatment. It's not a one-stop solution, but this is why it's so important to get treatment, because there are long-term effects of this condition.
Yeah, yeah, 100%. Like and guys, I think for a very long time, like I've seen even in my, my mom's generation and my grandparents' generation, PCOS को seriously कोई लेता नहीं है. Everybody is like, अरे, low energy, तुम इतना you're just lazy, like, थोड़ा yoga कर लो, like all this stuff. But the fact is कि PCOS एक real condition है. It is serious. आप जितनी देर लेंगे ट्रीट करने के लिए उतना it will just keep getting worse and worse and worse. And as Dr. Tanaya is saying, right, it can cause cancer, it can cause diabetes, it can cause, obviously it's one of the leading causes of infertility if it gets very severe. So please don't put it on the back burner कि एग्जाम्स खत्म हो जाएंगे तब देखेंगे, वेकेशन होगा तब देखेंगे. नहीं, you have to start today, don't wait, right? um,
Absolutely.
one more question, and again more broadly related to PCOS. If I'm a thin person, how do I treat PCOS?
So exercise is good for you whether you're thin or you're not thin. And exercise can not just help in balancing your hormones, but it can also help in boosting your mood, boosting your libido, and general increased overall health. So, depending on what your hormonal status is, depending on what your symptoms are, obviously your doctor will give you a more specific plan to yourself. But exercise is actually really, really good, and so is lifestyle interventions in the way of your nutrition. You can also get certain medications. So, excuse me, you can get what people are very scared of, कि diabetes की दवा खिला दी है, metformin दे दिया है. Metformin can be really helpful in balancing the so one of the things that happens with PCOS is that the insulin is one of the hormone our body produces, and normally your body listens to it. But with PCOS, your body is like, I'm not going to listen to you. And then it stops metabolizing sugar properly. So metformin is a drug that can help in I don't know, correcting that sugar metabolism, and then therefore correcting your PCOS in a lot of ways. So eating better, getting exercise, all of these things, and then the diabetes medications, be it metformin or be it the chota bhai of metformin, which is inositol. All of these things can be very, very helpful. So more dedicated plan would be going to your doctor and speaking to them.
Yeah, yeah. Actually, this idea of being skinny or being thin and having PCOS is very confusing to a lot of people, because I mean I've had people tell me कि doctors have told them कि नहीं नहीं, you still have to lose weight, which by the way can be very, yeah, which can be very very scary, and like it can actually have really bad impact on your health, right? Like if you're already
Yeah.
quite thin. So please make sure you're talking to, people who understand PCOS well, because in the case of lean PCOS, as Dr. Tanaya is saying, it's not about losing weight. It's about so many other things, right? Like exercising will help not to lose weight, just to, keep your hormones in check. Even diet changes to some extent, again, not to lose weight, but just to keep the PCOS symptoms from, becoming more aggravated. And then stress, I think, is always a big thing, especially in the kind of lives that we all lead today.
एक तो हम लोग को ये ईटिंग हेल्दी और एक्सरसाइजिंग ना ये पनिशमेंट लगती है मोटे होने के लिए, ये लाइफ का रेगुलर पार्ट नहीं लगता है कि ये तो जरूरी है, ये करना ही है वैसे भी.
No, exactly. And actually, the thing is ki lifestyle, like actually the people who have PCOS, like you just end up eating healthier, you end up living a healthier life. So in a weird way, it's actually something that you should be doing anyways, Okay, cool. So maybe we'll take one or two more questions. Are you seeing any, Dr. Tanya, that you want to take?
Going too fast actually for me because I'm not able to look at the same screen.
Yeah, so somebody's asking, I think we've gotten a lot of questions about myo-inositol, and I know you started to briefly talk about it, but like, what does inositol do? Why is it used in PCOS? Kya hai ye?
Without making it too complicated, a very good way of understanding is कि ये सच्ची में metformin का छोटा भाई है. So if you, I don't know if this is the right way of putting it, but if you process ionositol, which is generally a natural compound, further you can extract metformin from. Not you can't. It's the one step before metformin essentially. It's the natural step before metformin. So what metformin does is it's the teacher in your body. You have a classroom inside your body, and everybody has to listen to the class monitors and behave properly. Now your class monitors are telling your body कि भाई sugar आई है, इसको process करके अच्छे से इसको store करते हैं and we'll release it in the parts that is required. But your body is just like, no, I'm not going to listen to the class monitor. So you can send a teacher in the form of inositol, or you can send the principal in the form of metformin, who can tell the class to listen to the class monitor. That's essentially what this drug does. So one of the problems with the inositol is that it's quite expensive. So if you go for buying these supplements, they can be in the pricier range, which is where metformin can be very helpful. It's also the more direct version of it. कुछ लोगों को metformin के बाद stomach upset होता है. So if you are struggling with that, see if you can do inositol. But these drugs, they sensitize your body to the insulin your body is already producing. You're already producing it, your body is just not listening to it. So yeah, actually very, very helpful. What I hate though is when people are like, oh, we're making PCOS super gummy, and they'll put inositol in it, and then they'll put like 30 different vitamins in it. You don't need that. You need a targeted dose depending on the insulin levels in your body, the sugar levels in your body, and that would involve speaking to a doctor.
Yeah, 100%. One other thing that we're getting a lot of questions on right now is homeopathy versus Ayurveda versus allopathy versus trying to manage period irregularity just through lifestyle changes. Lots of different options. What is your take, doctor?
As long as whatever pathy you're following is telling you to include lifestyle interventions and are not telling you कि हम आपको दवाई देकर सब ठीक कर देंगे, then it's okay, whatever works for you. With that said, we have It's a very controversial statement, but it is very science-backed. We have ample evidence that other than evidence-based medicine, which is allopathy, which is an outdated term, by the way, none of these other pathies really work. They lead to something called the placebo effect that you guys can go and read about. I will not land myself in a bucket of hot water by saying anything, so do your own research. But as long as, like, I mean, coming back to the same point, as long as they're telling you to include lifestyle interventions that impact your health in the long term in a good way, all is well.
Yeah, 100%. I know what you mean about being in a bucket of hot water, but guys, the evidence is, and by the way, I didn't know allopathy was an outdated term. What is it called now?
We don't say allopathy anymore. We say evidence-based medicine.
Ah, interesting.
Because that is the only form of medicine that has evidence behind.
Right. So guys, if somebody is telling you कि इसके कोई side effects नहीं है, ये तो मतलब 100% cure कर देगा PCOS, please do your research, you know. किसी भी चीज के side effects ना होना, is it because उस पे research नहीं किया है, or is it because, you know, like there's actually no side effects? You have to do your own research and understand. But you know, the kind of
पानी पीने के side effect होते हैं, तो कैसे किसी drug के नहीं होंगे?
Yeah, exactly. And by the way, we've had a lot of patients who we've seen at Veera Health who've tried, you know, many such alternative treatments, right? Like homeopathy, Ayurveda, and usse things have become worse as well. You know, acne has become worse, hair loss has become worse. So just be very careful who you decide to go to, because the longer you spend with, you know, some other kind of treatment that's not working with you, that just delays the time that, you know, you can actually get treatment that works.
And another thing that's very important to mention in these is that because a lot of these substances are not controlled because they're naturally derived, we don't know how much of the active compound is coming out of it. So haldi is very good for you. Haldi has an active compound called curcumin, but curcumin has to be taken in a certain dose. If you take the curcumin extract and use it in extremely high doses, it can be dangerous for your body. It can lead to issues like liver failure. So it's not just some halka phulta ki, matlab, you know, baal jhad jayenge or whatever. It can lead to toxicity in your body. So please be careful in what you're consuming. Don't just buy random pills off the internet. Also, very important.
Yeah. Let's take one last question, Dr. Tanaya. What do you think? So
Yeah.
So this is like the holy grail of, I guess, people control pills for a long time. Is there
I
are
lost
lots
you
of
for a second.
No, so people are asking, is it safe to be on birth control pills for a long time?
Birth control pills they protect you from cancer. Birth control pills are wonderful. I understand that there are side effects for a lot of people, which obviously makes them unusable if it's affecting your mood to a degree where, you know, you're unable to carry out your regular functions. बट आधे से ज्यादा लोग बर्थ कंट्रोल पे ये सोच के जाते हैं कि ये तो बहुत बुरी चीज है और बहुत बुरा होने वाला है मेरे साथ, एंड फिर वो दैट यू नो सेल्फ फुलफिलिंग प्रोफेसी बन जाती है वो कि मतलब अब तो मतलब खराब होना ही है और खराब होना ही है. यू नो, वी हैव सो मच एंजाइटी एंड फियर अराउंड a very legitimate helpful method. And one of the things to recognize very, very importantly in this anti-birth control crusade is that a lot of religions don't permit the use of contraception. So there is a religious angle behind demonizing birth control pills. If you go to the quacks who keep saying that birth control pills are bad for everybody and they deprive your body of vitamins, which they don't. We have more than enough evidence to show that they don't. You will go and you will find that there will be some fundamentalist, hardcore religion angle in their profile. This is not me talking out of my ass. This is well documented scientifically that there is a very strong anti-contraceptive crusade that is happening. So it has deeper roots, it has more insidious roots, and birth control is not bad for you. With all of that said, if you are struggling with the side effects and they are severe for you, we have hundreds of different options.
Yeah.
Sorry, that was a rant. I'm writing my chapter about this right now, so I'm extremely
No,
well versed in these topics at the
I,
moment.
yeah, this is so interesting. I had no idea that there's like a whole religious angle to it because, I mean, then it comes down to like, why should other people have an opinion on what women do with their bodies, right? Like, you
Yes.
should be making
It is
that.
a feminist issue.
Yeah, it becomes a feminist issue, right? Like, this whole, birth control pills are bad for you, they're bad for you, they're bad for you. If you don't do your own research, you're basically just, falling into what other people want women to do with their bodies. So, I think informing yourself, being aware, and as Dr. Tanya is saying, right, like try a few different brands of oral contraceptive pills. If one is not working for you, another will. I've taken oral contraceptive pills in the past, and they were amazing for me, right? Like, I just thought that it was the best thing ever, right? Like, regular periods, like, your skin is amazing. I mean, I'm not on them anymore.
Lighter periods.
Lighter periods. So I was pretty amazed because I had heard a lot of those misconceptions as well about it. And then this question, because I think it comes from a spouse of somebody who has PCOS, which I thought was really nice. Someone is asking, how does a spouse of a woman who has PCOS understand what she is going through? How should they support her during this whole process of, I guess, conceiving and treating PCOS over time?
That's really heartwarming that they're considering and they're being that considerate.
Yeah.
Um, I think educate yourself on what the condition involves, educate yourself on how it can directly affect not just their physical health, but also their mental health. And, trying for a baby is already a very challenging part of life. So if you throw in a chronic condition on top of it, it can be extremely frustrating. So, yeah, I think educating yourself and communicating the best ways to go about it.
Awesome. Cool. So I think we're gonna call it a day. We've had a pretty long live. Lots of really good questions from you guys. Thank you so much, Dr. Tanya and Dr. Futris, for spending this time answering these questions. I think the work that you do is so important. You're really leading the charge on creating awareness around actual, how should women take care of their bodies, real, reproductive and sexual issues that never used to get talked about before. So huge kudos to you. And for everyone else who's watching, guys, PCOS is a real condition, right? If you have irregular periods, if you are gaining a lot of weight, you have hirsutism, which is excess hair on your face or body, hair loss, some of these symptoms, please go and get it checked out, right? Like, it's a serious condition. It can cause cancer, it can cause diabetes. You don't want to have it. It can cause problems in conceiving. And Veera Health is definitely something you guys should check out, right? We combine both the lifestyle aspect of it. So we tell you what to eat, how to exercise, manage your stress, along with the medical aspect of it. So there's actually a gynecologist and a mental health therapist, a dermatologist who's following your entire treatment and actually tracking your day-to-day symptoms. 93% actually of people who use Veera tell us that it's better than anything they've tried before, which is huge, guys. So come check us out or talk to your own doctors if you have them. But thank you so much for joining today. Thank you, Dr. Cutris. Amazing session. We'll do more of these and hope you guys have an amazing rest of your day.
Thank you so much for holding the space for these conversations. And guys, I vouch for Veera. I get approached by a lot of PCOS companies, but there's only one I work with. So really, I honestly do recommend checking them out. So yeah, have a good evening, everybody. And thank you for this.
Awesome. Thank you. Bye.
All right. Bye.